Welcome back to Wellbeing in Practice podcast, bringing you the latest in complementary and integrative functional medicine conversations to provide you, the practitioner, the opportunity to learn from a variety of guests that we will have on in how to and how they actually unravel and approach cases that they see in clinical practice. I'm Tanya Borowski, Head of Education for Amrita and your host. And today I'm here with Dr. Joe Mather. And we're going to be talking through a really fascinating case about that originated as Hashimoto's, and we're going to be leading through how we integrate working with the gut. Joe, welcome.
Thank you so much for having me, Tanya. I've been looking forward to this conversation for a while now.
Yeah, so it's just such a joy to have you here. So I think it might be a nice place to start to actually introduce yourself and how we came to have this, start to have conversations, and really was sort of a meeting of minds, wasn't it? In terms of how we decided to have wanting to deliver this information. So could you explain to our listeners what your background is, Joe, please?
Yeah, I'm a conventional medical doctor who, after finishing my medical training, realized that the conventional tools weren't helping any of my patients get better. And so
Okay.
I branched out into integrative and functional medicine. And I've been practicing, a combination of integrative, conventional, functional medicine for the last 10 years, ever since.
Okay.
I practice in New Orleans, Louisiana, and see people in person, but in previous stops have worked with patients all around the world, throughout the US and many countries internationally. And I like to think that that gives me a broader perspective on the field of functional medicine, what's going on, and how to help people get better.
Amazing. Thank you. Yes. And we kind of came to have this conversation, didn't we, about this sort of need, this sort of, that in functional medicine, there can be this tendency to just dive straight in and just and over test and run huge sort of elaborate amounts of function of labs. And we sort of felt that there is absolutely room for using standard labs and to actually get the foundations in place and make sure that we are being true to the patient.
You know, it's shocking to the degree to which advanced labs and excessive labs have become synonymous with functional medicine.
Yes.
And, here in the States in particular, when someone has seen a conventional doctor or two and haven't gotten better, they are asking what's out there, what else can help me? I'm really hurting, but the conventional labs haven't given me an answer. And then here you have functional and integrative medicine providers saying, well, here are all of these extra labs that we can use to really identify exactly what's going on with the patient. And the problem is that many of these labs just aren't as good as they're made out to be. They're not as helpful in guiding treatment, and they can lead to dead ends. And we'll talk a lot about thyroid, because I think this is one of the examples where patients are done the most disservice from integrative and functional care.
Me too. I absolutely agree. So, and I feel that it's very much a situation of shooting the messenger. If you see a TSH that's a bit high or a T3 that's a bit low, it's like, okay, you've got hypothyroidism and that's what you need. And we're going to put you on a whole load of thyroid supplements or et cetera, et cetera. So let's dive into this case. So could you introduce us to can you give us a little bit of background about your client? She came to you presenting with a diagnosis of Hashimoto's hypothyroidism.
And I'll do even one more layer of background. The most pertinent information is that I started working with KB, the patient in this case study, directly after doing training with the Institute of Functional Medicine.
Oh, I love
and reading
this.
a whole bunch of books, a whole bunch of textbooks, listening to podcasts, and then going to the source at IFM to try to figure out, okay, conventional medicine isn't working. What can I do in the integrative realm to help patients? And so I was just ready to go, full of vim and vigor and ready. And I thought I had all the answers. And KB was one of the first patients where I said, oh, this is a perfect time for me to try all this functional medicine.
Okay. Great. So
So
what happened at the initial visit?
the the big picture here, and we'll talk about the initial visit, but the big picture is me failing, right? This was me as a new integrative practitioner getting it wrong time and time again. And this patient, KB, she was a pretty healthy woman. So she was 49. She was menopausal. She was an attorney with high blood pressure, cholesterol issues. She was a decent, healthy weight.
Okay.
Um, she wanted to lose a few pounds to slim up, but she slept well, she exercised, she ate a okay diet, and was doing all the things that we would kind of expect someone to do to be well. But still,
Yep.
she really was having trouble losing weight, and she had fatigue, right? So
Okay.
that was the initial picture. She was on some medicines that we don't need to go through. You can just think of the standard, maybe half dozen medications that someone in this place might be on.
Okay.
And so
Great.
I saw KB and I said, okay, she's tired, she's fatigued, and I know she has a background of thyroid problems. So I did a whole bunch of thyroid labs,
Yep.
right? And showed that, oh, okay, KB actually has Hashimoto's thyroiditis, an autoimmune form of thyroid problems that is the most common autoimmune disorder. And
Absolutely.
one of
And
the
that hadn't
things,
been picked up before, correct? She had she was on thyroid meds, but
yep,
she hadn't been picked up that she had Hashimoto's. That's right?
That's that's exactly
Perfect.
correct. And this is
Yep.
this is a scenario that plays out in functional medicine offices around the world all the time, right?
Totally.
People
Yep.
do a TPO or thyroglobulin antibody, it becomes positive, and then all of a sudden the patient
That's
doesn't
the
just have a
answer.
low thyroid, they have, autoimmune disease.
Yep.
And there's a layer of fear that goes with that I think is problematic. So unfortunately, I had fallen into that trap, right? I came right
We've
from
all done
IFM
it,
and I
Joe.
said,
We've all done it.
holy
Yeah.
moly, she's got autoimmune disease. I need to really go in with all guns blazing and give her everything I knew how to do at the time. When the first labs came back, they were okay. Um, Her hormones weren't terrible, but the antibodies were elevated to some degree.
Yep.
Her TSH was 2.4, her free 3 was 2.5, and her free T4 was 0.8. But I had been taught that there are optimal ranges that you want to get the thyroid into, that the key to fixing some of these problems of fatigue, brain fog, metabolic issues, weight gain, hormone imbalances is to get the thyroid into a sweet spot. And they call it optimal ranges.
Yep.
And so I really jumped in and started tinkering before too long. How can we get these thyroid numbers in a perfect range? And it really didn't work. And I got quite frustrated. Without going into all the detail, I tried 6 different combinations of medications, Armour thyroid, Synthroid, other natural forms of thyroid. I gave synthetic T3 plus synthetic T4, all with the aim of normalizing these numbers.
So just
And
actually to say, so when you say normalizing, so I mean the labs were essentially, other than the antibodies, so the TSH was in range, the T3 was in range, but it was a little bit, it was nudging the bottom of the range, and the T4 was just at the bottom of the range. But absolutely, as you say, we're sort of taught this model that, okay, the T3 has got to be much higher than that. It's not, it's sort of really trying to focus on the bullseye, if you like, of what is called this
yes,
sort of sweet spot. So that's what you, and that's
yes.
what you were trying to do. Yeah.
Yeah, so you'll hear this mistaken and incorrect idea that
Yep.
the optimal range for a TSH is between 0.5 and 1.5,
Mm-hmm.
right? And so I looked at her labs, and although a TSH of 2.4 is perfectly normal, I know in retrospect, at the time I said, oh man, she's got autoimmune disease and she's not quite where she needs to be on thyroid. So my
Yep.
job as an integrative doctor is to force the thyroid into that range. And that's the thing that I've seen again and again just not work for patients. And so,
Mm-hmm. I
with a
agree.
decade of experience now, I see so many people who have been going through this, getting their blood drawn, getting a thyroid dose change, getting their blood drawn again, another dose change, and they waste years of their life thinking that they're just almost there to getting their fatigue gone if they can just get their thyroid. And unfortunately, the doctors are doing this because they're taught from a lot of educational sources that that's the right thing to do. And one of the reasons I'm so excited about this case is that it just shows that it's not the right thing to do, but even better, there are other ways that you can help get the thyroid working that doesn't involve chasing your tail and
I
chasing
love it.
numbers on a page.
So that's really clear. Thank you. So, and I've absolutely been in this, I've been there myself. Absolutely. Yeah, absolutely. So then she came back for her next visit, and you've made these changes. You sort of changed her diet. You put her on, fairly restrictive kind of diet. So which is what we're taught. So you put her on a paleo diet. So took out all gluten, dairy, soya, sugar-free. And let's just remind ourselves, she was actually feeling pretty well before that.
That's the worst part in retrospect, is that I made, over the course of 6 visits, young functional medicine Dr. Joe made his patient worse.
This is great.
I actually listed it. Well, you have to make mistakes to be able to learn how to do better. And
You
I'm
really
hoping
do.
that by sharing the mistake I made, other practitioners don't have to do this. And
No, and
KB's initial suffering wasn't in vain. So
okay. So
we spent
let's move
6
from
visits,
that.
6 visits,
Visits.
and something like maybe 6 months, 8 months. And what I did was I made sure all of the lifestyle was optimal. So I made her sleep more. I made sure she continued to exercise. I changed how she exercised. I talked to her about stress, and we managed stress a little bit better. She was a busy practicing attorney, so we started doing some mindfulness and breathing. I tried a paleo diet, and then when that didn't work, I tried an autoimmune protocol, which is a stricter version.
Hardcore. Yeah.
It's very hard. If you've given it to patients and you haven't done it yourself, I advise you to do it yourself and see how hard it is. I took all alcohol away from her. And those things didn't move the needle. They just made her feel worse, more fatigued,
and her
more
antibodies
irritable.
actually kind of climbed a bit.
They sure did. I gave her all of the nutrients that I was taught to support thyroid. And this is one of the big fallacies, that if you just give the right thyroid support, that the autoimmunity will calm down, that the thyroid gland will all of a sudden start producing more hormones. So I went on that theory that I was taught at the Institute of Functional Medicine, and I gave her CoQ10, I gave her magnesium, I gave her selenium, inositol, and carnitine. And these are nutrients that have some usually mechanistic.
Yeah, they do. I mean, certainly selenium and inositol. I mean, there are some well-known papers that, absolutely.
And so it's not like I was just giving random things. These were things that should work, right?
Yep.
But they certainly didn't work here. I gave her vitamin D, I gave her fish oil, nothing happened. And then again, I gave her multiple different formulations of thyroid hormone. And I was left at the point where she was clearly worse. She was becoming more fatigued, getting headaches, getting lightheaded, abdominal pain, her blood pressure was up. And I was thinking, man, I know conventional medicine doesn't work, but maybe functional medicine doesn't work either. I was really at the point where I was wondering if I was sold another bag of goods, because I had done everything they taught me, and the patient had done everything I asked her to do, and she was worse. It was pretty disheartening.
Yeah, it is pretty disheartening. I think this is going to be so helpful for our practitioners to hear, because every lecture is, a case study is presented where it all goes swimmingly, and I really am so grateful for you to come on here and be so transparent in terms of, and for KB, wow, for kind of sticking through this, because there is
I have often sent her some mental thanks, because if she had not stuck with me, I never would have learned this. I never would have been able to figure out what actually was making her sick. So after that kind of, I was almost despaired, because I really thought that functional medicine was going to let me help patients. And that's all I really wanted to do with my life. I wanted to be a doctor since I was little. And just striking out again and again, I was getting burned out. So I started learning about the gut and the gut health. and there were some papers about a gut thyroid axis. And so perhaps there was a link there. And so I kind of threw a Hail Mary, right? A one last ditch effort, right?
Okay.
Hopefully this will work. And I had her do a stool test.
Okay.
And the stool test came back with a lot of problems. There was imbalanced dysbiotic bacteria. There was a lot of yeast.
Yep.
And I said, this has to be it. So I basically had her stop everything that we were doing before, and I pivoted over and used all the things I learned about gut instead. Now, mind you, she really had never complained of GI symptoms, particularly in the beginning. This just was kind of in the background. But what I did was I gave her broad spectrum probiotics, so two different types of probiotics.
Yes.
A fiber, a gut healing formula as a basic treatment, and then I had her do some herbal antimicrobials, so an herbal blend and oil of oregano that reduce bacteria and yeast in the gut. And this isn't how I do it now. I've gotten better, and we don't have to use as much.
I was actually just going to ask you that on retrospect, would you consider going in just with the probiotics for a period of time before going in with the antimicrobials?
Absolutely. Absolutely, I would.
Yep. Which is
it's
sort of
really
what I've pivoted towards doing far more.
The single most important thing that's missed for a lot of reasons.
Yep.
Most patients, so KB didn't have gut symptoms here. Many of my patients now have SIBO, have IBS, have colitis, where they have a lot of symptoms. For those patients, I will almost always stack treatments consecutively. So I'll start them with a diet, and then very quickly I'll add probiotics right behind that. They do the diet by itself, and I typically start with a low FODMAP diet in a lot of GI cases. And I have them do that for 1 to 2 weeks by itself, so they get a hang for that. Is it working? Is it not working? Are they not sure? Do they need more help, more support? That's step one, is just analyzing that by itself. Then you move to the probiotics, right? And then the same question, are the probiotics helping or not helping, right?
Yep.
That's kind of the basic start that gets you most of the way there for many GI cases.
Yep. Love it. Okay, so
whereas
back to KB.
In the past,
so you
I threw everything at her at once, right? That's one thing I would definitely do differently.
You threw everything at her, but it was targeted but it was targeted completely differently. It was at the gut. So you took her off all of her thyroid focused supplements, and but presumably you kept her on some form of thyroid meds, or not?
I kept her on her medications. Yes.
Yeah. Okay. Perfect.
Yep.
Right. So you started treating the gut. And how did that go?
It was amazing. It was what I had expected to see by giving her the nutrients and the paleo diet, and then the AIP, and then the extra support. I was expecting what happened to happen way earlier. And what actually happened was I didn't hear from her for a while because she was doing so well. She didn't need all of the support. She ended up doing about half of the things I told her. The probiotic, she had expanded her diet, and she found the oregano made her nauseous. So she ended up using the herbal blend. And when I saw her next in a few months, she was a different person. She had a sparkle in her eye. She said, everything has been fine. Her energy was up 30%. She then at that point mentioned that she had low-grade GI symptoms for a long time. Constipation, diarrhea, bloating. Never told me about it, but they completely went away. She didn't tell me, but she had been on omeprazole, proton pump inhibitor, for a long, long time. And she was just able to stop it without asking or doing anything. And her blood pressure went down. So everything started to get better. Her energy was finally improving. She was back to exercising. And I said, oh, maybe I just missed the root cause at the beginning. Maybe she wasn't having thyroid autoimmunity because she was deficient in thyroid hormone.
Yeah.
Maybe she didn't have autoimmunity because of a diet or lifestyle or lack of nutrients or too much inflammation. She had GI problems. She had GI dysfunction that was causing her autoimmunity. So what this taught me was that when you treat the right thing, when you treat the cause, symptoms go away and it's dramatic. And that's the single best thing that I think people need to refocus on. I see practitioners chasing labs for years and their
Yes.
patients don't get better, right? So
Yep.
it was bad enough that I did this for 9 months or so with KB. I see patients who have seen other doctors for decades not getting better because we've forgotten to listen to the symptoms. We've gotten so distracted by the lab ranges and the new tests and the technology that we've forgotten to listen to the symptoms. But when you treat the right cause with the right tool, everything should improve. And that's what we saw. And I'll stop for if you have any questions, but it went deeper than just, her energy being up a little bit.
Definitely, I'd love to go into that more, but I actually, I would like to ask a question. Thank you. In terms of, and Joe has shared with me the sort of the lab results, so I don't have a crystal ball, but I think what is to what you've said, it really resonates with a lot of the experience I've had in clinical practice, and exactly sort of I've had many KBs too.
Yeah.
And there was this sort of light bulb moment for me, which very similar for you, when you're in terms of it's great that we're identifying these antibodies, but I feel that the lens in functional medicine has shone too brightly on
Yes.
these antibodies in terms of this. First of all, we need to establish, if you agree, we need to establish what that patient's baseline is. So KB came to you, this had never been identified. The first time you ran her TPO antibodies, they were at 305. Okay.
Yep.
And then they began to, then over the next 8 months, they escalated. So you had a baseline. We don't know what it was before because it had never been tested. But the
Right.
interventions that you made, trying to do the right thing, seem to exacerbate the issue. And they got as high as 700. But we're looking at so when the dial started to turn, and you've said that the antibodies actually at their highest were at over 700. And then they did, when you treated the gut, they then did return to 305. Now, if the lens is continue to be shone on this, like the antibodies have got to be below 35 because that's what the lab range is.
Yeah.
It's actually, but how is the patient as well? The patient is feeling well. The patient is feeling better. The antibodies are not keeping to escalate. So
can we talk about antibodies for a second?
Yeah, please, let's go.
Okay, so when you go to IFM and when you read there's even a bestseller out there that perpetuates this idea that any antibodies are extremely dangerous and increase your long-term risk.
Yep.
And so I see people diagnosed with Hashimoto's with antibodies of 36 or 42.
Yeah, me too. Yep.
But the clinical literature very clearly shows that really long-term damage is happening when the TPO is over 500.
Yeah, okay.
Right? So there's a huge chasm between, 50 and 500 where people are being panicked. The risk here is very, very low. So even if you do have positive antibodies, the risk is that you develop full-blown hypothyroidism.
Yeah.
Right? Where your thyroid gland doesn't produce more hormone. But for many of these patients, they're already on hormone. And so scaring them about the consequence of having to take hormones is kind of silly.
It's true. This is true.
The body's supposed to make antibodies. It makes antibodies to all sorts of tissues. It's one of the ways it prunes dead cells. It cleans up inflamed, damaged tissue using antibodies. It's like a hedge clipper, right? It just trims the top of the hedge, cleans it up so everything looks nice. You're supposed to have some. And so for practitioners being taught this idea that any positive antibodies are this dire, horrible thing, I think is just really mistaken.
I entirely 100% agree with you. And so, yeah, it's a hard lesson as a clinician to learn, but it's absolutely sort of enhanced your connected thinking, and it's certainly, I think it's very, very illuminating. And it also sort of highlights that this sort of, it's actually, yes, it's about us as clinicians we can do this training, but we can never just take a protocol and we want to, this is, you and I feel very passionate about this, is that we've got to, it's a guideline for us to explore different connections and to pull different levers to be able to uncover where the root cause is, right? Yeah,
absolutely. When pulling back, it's not just that that practitioners might be scaring patients about a TSH that's mildly elevated, right? A TPO is 75, who cares? Nothing is going to happen, right? But it's not just that they're scaring patients. The real thing that gets me fired up, angry even, is that they're inappropriately treating patients with thyroid hormone. And this has real consequences. It's not just a benign, oh, we'll just support you with extra thyroid hormone.
I agree.
We know for a fact that it causes atrial fibrillation, it causes anxiety, it causes agitation, it causes insomnia. It may increase your cardiovascular risk, right? These are not small things. We know it increases osteoporosis. There's mixed evidence on fractures, but certainly in the right patient, giving too much thyroid hormone can thin bones and potentially cause more fractures. This is serious business. And more people are being taught that they need to optimize their thyroid hormone for a host of problems. And doctors are happy to do it because it's an easy prescription and they think it's safe. But it's really harmful. And so if it were just doctors kind of making a clinical laboratory mistake, it's an academic thing, and we can argue about what level of TPO has what risk, that's one thing. But when the horde of practitioners are moving towards this idea that you just dump thyroid hormone into someone and you optimize them and they'll be fixed, it's not just wrong that it doesn't fix them, it hurts them. And I see this more and more of patients coming into my practice, and they are being made sick by thyroid hormone because they're being treated for a condition that they don't have.
It's being shooting the messenger. Yeah.
So when when the thyroid gland absolutely needs thyroid hormone, when all of the studies show that we benefit from it, the TSH is over 10. That's the hormone that the brain secretes to the thyroid gland to tell it to work. So normally it should be much lower. When it's 10, right, the brain is like, you're not doing anything. Wake up, work, make hormones. And the hormones, T3 and T4, will be low. That's hypothyroidism. That's your thyroid gland is not picking up its end of the bargain. It's not making hormones. And when you give those patients thyroid hormone, they benefit. They feel better quickly. Their cardiovascular risk goes down. And every doctor in the world, if they're not giving a thyroid hormone, right, should be, right? It would be nearly malpractice or way against the conventional wisdom. But what's happening here is that people with normal T3, normal T4, their thyroid gland is not hypo, is working, it's making the hormones, but the TSH is a tick above normal or a tick above what someone has made up as optimal. And it really is made up. It came out of nowhere. When these people are given hormones, they're harmed. And there have been hundreds of studies asking the question, do patients benefit if you give them hormones when their T3 and their T4 are normal and when their TSH is slightly up? And the overwhelming number of papers say no. It really does not help. So it's not helping patients. We call this subclinical hypothyroidism.
Yeah. And this is big and I've absolutely been that clinician. And my head was turned about 5-6 years ago exactly to this. It's like this is a TSH of 4, 5 is it's responding to the environment. So if you've got a
Yes.
normal T4 and you've got a normal T3 and the TSH is at 4 or 5 in functional medicine, that's, you treat the thyroid. But actually, it's asking the question, what is it responding to? Why, if
Yes.
the T4 and the T3 is normal, there is
Oh, Tanya. Yeah.
uptick in TSH because there's something going on. Maybe you've taken the blood at the wrong time of day, or there is a bit of inflammation going on. Where is that coming from? What is it responding to?
It should be the question for a good practitioner like you're asking, okay,
Well,
what's causing the TSH to be up?
yes.
TSH
Yep.
is not itself the cause of all the
No.
problems. The TSH is coming up because there is a dysfunction somewhere else in the body, most often gut, right? Sometimes lifestyle, sometimes toxins, but the practitioners need to stop saying, the TSH is up, I'm just going to optimize the hormones. They need to start asking, why is the thyroid doing this? And once
Perfect.
they start doing that, that's when they're going to get better outcomes, not by chasing numbers with hormone.
I love it. Joe, could I ask you, have you had a similar experience? Because a viral burden is talked about a lot in terms of being a trigger,
Yeah.
specifically Epstein-Barr or cytomegalovirus
Yeah.
being a trigger. Have you, he's smiling, so I'm guessing the answer. Have you gone after a viral burden
I
and had
have.
any success
Right around the
with,
same time that I was treating KB and going after the micronutrients, the nutrient replacement, all the elimination diets, doing that sort of stuff, the other thing that was really taught in almost every lecture was chronic viruses are causing chronic
yeah,
symptoms. And so you need to look for Epstein-Barr and check the early antigen and
early
all of
antigen,
these
yeah.
other antibodies. And so by this point, I had gotten a little bit smarter. And so I took about a dozen patients, and most of them had Hashimoto's. One had lupus. I think two had IBS. It was kind of a scattering of autoimmune and chronic fatigue
Right.
conditions.
Yeah.
And
Yeah.
and when those patients tested positive for Epstein-Barr, I hammered them with antivirals, acyclovir, monolaurin, all sorts of nutrients, diets, herbs. They really, I went after it. And so I said, if chronic viruses are causing a problem, I'm going to see some of these patients shift dramatically.
Yep.
And nothing happened. Nothing. None of the antibodies went down. Their symptoms didn't change. No difference in
Amazing.
fatigue. No difference in outcome. And so I kind of relegated chronic viruses to the dustbin in my
Okay.
practice, and I really don't spend much time on them. Now, there are a few exceptions, but it's really, really, really the exception. Some patients get dramatically sick after an acute virus and never are the same afterwards.
Yes.
And
Yes.
that clinical history is a little different than just someone who struggles with amorphous health problems and has a positive Epstein-Barr marker or cytomegalovirus. And in those cases, you do want to consider viruses, but in my experience, there's something driving that level of dysfunction that's not the virus. There's
It's
something
more of a
that sets up
mitochondria.
the
Yeah.
immune system
Yep.
for failure, and then the virus tips them over the edge. The virus itself is not the main driver.
Yep.
It's
Got
usually a
it.
mold toxicity, right? Another environmental toxicity, lifestyle problems that are setting up the immune system for failure.
Yep.
And so again, the Epstein-Barr is the messenger. People are just
Yeah. Yeah.
shooting
Yeah.
the messenger, right?
Yeah. No, that makes complete sense. And then let's just sort of round this off with, let's just round this off with talking and then sort of come to the end of the case. But
Sure.
the elimination diet as well. That was so you because I'm less, from my point of view now, definitely in the last sort of decade, even less is more. And it's trying to, what is the least that you obviously we want to optimize health, and it's
Yeah.
about, but it's
Yeah.
about what I sort of quite often turn it around, or always, so what I would like you to add back in, rather than giving you this massive list of what I want you to take out, and you're feeling miserable, but now you're going to feel even more miserable because I'm going to take out
I know.
every item of joy that you've had in your life. So,
I know. Like you're already hurting, so let's
Yeah.
make you feel worse.
So let's talk about the elimination diets and have you
Yeah.
had any examples of specific proteins that you can categorically say, okay, that has been responsible for causing a flare or sort of in a patient? Have you had any experience with that?
Yes. So I think any clinician who's paying attention will absolutely have patients come in and it's clear night and day they eat food X and have response Y. And it
Yes.
happens again and again. And to ignore that would be to ignore reality. But you can't take that pattern and then say the cure for all of these chronic conditions is a complicated elimination diet. And so the elimination diets for those, there's a whole, a million different variants, but the idea is you restrict a whole bunch of foods and then add them back in. And
Mm-hmm.
I don't do that in clinical practice because it doesn't work, because I have yet to see a patient who can accurately, introduce foods back in and determine what's causing symptoms. It's too amorphous. It's usually the
Yep.
immune system that's at fault. It's not the food. And so maybe you don't sleep well one night, and then the next day you try a tomato and you have some bloating or some heartburn. You say, "Oh my God, I'm reactive to tomatoes." But had you slept well or hadn't had a beer the night before, or a million different reasons, you may not have had that reaction. And so it's
Yep.
kind of a fool's errand, and people end up getting really disheartened. They get really down on themselves. I can't do it. I'm not doing it right. And they start creating all these harmful rules about food. And they start entering this really dangerous area that skirts eating disorders. And so this is one of the bigger hangups in functional medicine that I really wanted to shout from the rooftops. Restrictive diets lead to eating disorders, period, the end. We know this from a study that was done, about 300 referrals to a neurogastroenterology clinic. And the patients who were referred who had been given elimination diets had roughly a 3 times higher chance of having an eating disorder. And we see this in our practices. We see,
Sure.
you have to avoid lectins, you have to eat KetoFlex, you have to eat oxalates, low histamine, you have to do elimination, phase 1, phase 2, biphasic SIBO diet, you have to do 5 Rs. All of that, lends this idea that if you can just get the perfect diet, things
Yep.
will even out.
Yep.
It's very similar to if we can get perfect thyroid hormones, everything will be fine. And it's a fallacy. It's a fantasy, and it ends up harming more patients. So again, if it was just an academic disagreement that the lectin thing is silly, that's one thing. But when people are buying into some of these diets and then getting eating disorders, that's a real thing. And that's where we need to really be asking ourselves in the field of functional medicine, are we helping or are we hurting?
Yeah,
Right?
I totally agree. Totally agree. So, and yes, I mean, a very well-known book that came out sort of 15, 16 years ago was, yeah, absolutely, which is what I used in my practice for a long time, was, yeah, absolutely anyone with a Hashimoto's thyroid, they've got to be off gluten, they've got to be off dairy, they've got to be off soya, all of that. So
It's
now
not
it's
to
very
say that I
different.
feed patients gluten
No,
all
no,
day
no,
long,
me
right?
neither. No, but it's
Yeah, yeah, but
much
it's just for
more,
people
but it's
listening to
bespoke. It's
understand. Yeah,
exactly, yeah. So I suppose the question to ask you, and I will share one case of mine as well, is that
right.
we've sort of talked about absolutely supporting the gut, and that has been very successful with KB and other clients of patients of yours. Is there a case that you can draw from that there was one of those proteins that you definitely you can think of, okay, that client reintroduced that and it's caused an uptick in their symptoms or their presentation, that can kind of that proved out that particular food protein was an issue for that patient?
Over the years, just a handful. So gluten for a few
Okay.
patients,
Yeah.
absolutely. Tomato has done it. And sometimes it's not even a food. Sometimes it's some of the chemical substances that we eat that we
Yes.
consider normal. A case of eosinophilic esophagitis, so horrible burning and swelling in the esophagus, and it came from a Crystal Light water sweetener. So it was one of those flavor additives that you add to
Oh,
water to make water more palatable. And so this individual was wanting to drink more water to be healthy, but she just didn't like water. So she just started using the Crystal Light every day.
interesting.
And it wasn't, so we had her on, okay, well, we know that nuts and seeds and gluten and dairy might be causing this. We remove all those things, nothing happens. And it finally, we figured out it was the Crystal Light. As soon as she stopped that, everything went away. And the next time she had her EGD, all of the changes were normal, and she just felt better within days, right? So you knew that that was the thing. So
And there's a
sometimes it's,
really great example of actually keep digging in terms of keep asking the questions. You know, don't be so don't
oh
again.
yeah,
I say to the practitioners that I mentor, look up, as in look and talk to the patient. Don't get so focused on the labs. You know, just so I would imagine that's a great example of you. It must have taken quite a lot of quizzing to actually, you know, what is
yeah.
it that is triggering this for you
I
to
think you
actually
have to
draw
be,
that piece of information out.
I think you have to be a little abnormally curious to be good at this work, right?
Yeah,
I think those of us who are drawn to it, we really like solving puzzles and figuring things out, and not having the answers bothers us. And
I love that.
that was
That's
definitely
great.
one of them. But had I had I left KB alone, I really wouldn't have figured out how important the gut was to fixing thyroid. And happily, since then, this was not a one-off case. Oh,
Okay.
God, probably 50 or 100 cases, very similar over the
Yep.
last 10 years. I mean, this is just a pattern that happens again and again. And it's not to say that gut is the only reason why people have thyroid problems,
Of
right?
course not.
If you're
No.
treating the gut and the thyroid's not getting better, you're still missing something. And you just have to leave the idea that this is the one answer, and just leave things open more as a question. I think this is the reason why you're having this problem. Let's fix it and then reevaluate. And if you're right, things will go away. And then I tell my patients, if I'm wrong, you can yell at me, but then we're going to do something else. And I think that's the most pragmatic way to help people move forward. And it helps prevent you getting stuck in the morass of endless labs, endless blood draws, endless speculative tests, endless diets that just leave people stuck.
Joe, just so amazing. I mean, I know that there are going to be so many practitioners listening to this episode who are going to be jumping up and down. There's going to be light bulbs going off all
Oh, I
around
hope
the
so.
country, because we've all been there. And I think, and actually, so let's summarize. So what can we learn from KB and from you, and what are the kind of the key messages that that we can take from today, that we can apply in our practices tomorrow, that you want to shout from the rooftops? Can you share that with me?
You nailed one. Don't give up. Keep trying. Be diligent until we find the root cause. The other thing is that when you treat the right cause, symptoms go away. And it's not, maybe I'm feeling a little better. It's at the follow-up we didn't talk about. My hair is growing in. I'm exercising 5 times a week. I've got all my energy back. I'm sleeping soundly. I'm a new person. I'm eating king cake here in New Orleans and wine, and I'm fine. You know, I'm not flaring. I have no GI symptoms.
Love it.
That's the
Yep.
sort of improvement you're looking for.
Yep.
We've got to back away from this idea that optimizing thyroid hormones is the way to health. We have to get away from the idea that strict diets are healing. They're punitive often, and they're not the only answer.
Yep.
I really want people to stop putting TSH on a pedestal with the optimal ranges.
Yes.
You know, one fact that I often mention in these interviews is that people are using the TSH like it's this rock steady biomarker, but it changes from minute to minute, hour
Minute
to
to minute.
hour, AM to PM, and summer to winter. So it actually changes 1.7 points from winter to summer in the same person with nothing else changed.
I read that
It
paper. Yeah.
fluctuates, and that 1.7 points is enough to put someone out of optimal range. And for the audio listeners, I'm doing big giant quotes on the side.
Like Joe in Friends, and then he says, "I
Yeah,
don't know what this means."
yeah. It's, you know, just moving from February to July is
Yeah.
enough to put someone out of optimal range. And we know from the studies that way more cases of Hashimoto's and subclinical hypothyroidism and hypothyroidism are diagnosed in the winter months when the TSH naturally goes up. If you leave it alone, it's going to get better. And so I think people need to de-emphasize the thyroid being the ultimate enemy and the ultimate solution.
I think we underscore that. That is such a big message. We underscore it, we highlight it. That is such a big message, because that's what's been drummed into us in this integrative world, that we are doing better than allopathic medicine by having this sort of optimal thyroid range of sort of that you've just stated. And actually, the TSH is simply responding to the environment, and it's dynamic. It's a dynamic hormone. Like all of those other pituitary hormones are dynamic too. Why is TSH any different? FSH,
oh man,
LH,
that's a good point.
It responds to it responds to the levels of hormones in the periphery. Why is TSH going to be any different? Yeah. So
yeah, I think one of the reasons why this thyroid thing has almost become like political camps, where
it has.
The conventional doctors are only Synthroid, and any of those functional doctors ordering free T3s and trying to put people on armor or quacks and not treating with the evidence. And then you've got the integrative doctors saying, you conventional doctors, you're missing, a big piece of the free T3, because I have this patient on thyroid hormone, Synthroid, and then as soon as I added T3, they felt better. And I think that is a true thing. And I don't want people to think that I'm saying that doesn't exist, because it does. And there are a minority of patients, it's not every patient, but a minority of patients feel better on combination T3 and T4.
Okay.
Right.
Yep.
And I think that's important to state that there are some patients out there who need that. But the studies that are evaluating, do people do better on T4 or combinations? Those are patients who have true hypothyroidism. Their glands are not working. That's a completely different group of population than what most of us are seeing in our clinics.
Yes.
They're being diagnosed with slight hypothyroidism or mild because their TSH is up. It's not hypothyroidism. That diagnosis is incorrect. And that's why when I take them off medicine, they feel better.
It's absolutely incredible. That's really clear. Right. And then can we just finish with your, I don't want to say protocol, but when we're thinking about supporting the gut, can you just talk us through sort of how you do that in this type of scenario? Because obviously everybody's different, but can you talk us through your sort of basic sort of thinking and sort of how you would have a plan, which obviously you would then tweak accordingly to the patient in front of you?
Yeah. So, I kind of was taught the 5R thing from the IFM, and it's so complicated. And over the years, I've tried to simplify as best as I can. And so what I do from a very high level is always do things one at a time. And you're trying to get data from each intervention. Is this working? Is it not working? Or are you not sure? Yeah. And then the patient reports that back to me, and then we make a decision together whether to continue on that treatment or not. Right. But any treatment that's making someone feel worse, I have them say, you stop. And I don't care how much I like the diet or these probiotics. If it's not a good fit for you, you stop it. So we build in that individual plan right from the beginning. So what I have people do is very high level. I have them try a fast, because most people have never tried a fast before.
Sure.
And just a 24-hour fast will very frequently lower GI symptoms significantly. And then that gives me a lot of information on what treatments might help them. So that's kind of a little bonus. Just that can really be for a lot of patients to do. But what I do is after the fast, I have them try a diet. So if they're just eating a standard American crap diet, I have them drop the processed foods, and that's all I do.
Great.
Right. If they're like many of my patients and they're already eating pretty healthy, then I may have them go a little bit farther. Right. They may go gluten-free, dairy-free, sugar-free.
Yeah.
Most of my patients are already doing that as well. And so I go to a low FODMAP. So those are the three kind of dietary paradigms I use the most often.
Nice.
Particularly for gut symptoms.
Yep.
Then I add probiotics, and again, by itself. But the key here, I think that is missed is that you want to use a diverse grouping of probiotics, as diverse as you can make it. So in my practice, it's a lacto-bifido blend, it's
Yep.
Saccharomyces, and then it's a bacillus soil-based probiotic. I use all three. I
Yep.
start them, and then I slowly build the dose up on all three.
Yep.
And I just want to, doesn't have to be more complicated than that. I just see so many patients, you get a little bit of fasting, you get the diet, you get the probiotics, and they're done.
Yep.
And
I
don't
totally
need
agree.
more. They don't need boatloads of nutrients. They don't need boatloads of labs. And so many times I will do this before doing a single lab because it's basically free. And why get labs if you're going to fix their gut and then you know their triglycerides are going to come down and their blood sugar is going to improve and they're going to feel better. So
Yep.
I do that as the base, right? And then if they are improving, if
Hmm.
GI symptoms are improving, but they're not all the way gone, I'll do herbal treatment, right? To kill SIBO or to kill dysbiosis.
Yep. But
That's the
you
high
would,
level.
give the probiotics a good run for their money. So, I mean, I would do
Yeah.
what I refer to this as, I mean, it's not mine. I think, I can't remember whose analogy it was, but it's like what you've just described is triple therapy, as in give them a lactobacillus blend, Saccharomyces
Mm-hmm.
boulardii, and a soil base is sort of triple probiotic therapy. You would do that
Yep.
for, I would do that for a good 5 weeks, really, with the dietary changes to observe
I think,
change.
well, it depends on the patient, but I have some patients that will go on the low FODMAP diet and within a week, they're clearly better. And
Okay.
then they add the probiotics and they do great. And they're
Yep.
able to build the dose right up. And in 1 or 2 more weeks, they're feeling great. For some patients, if they've done diet for a week, probiotics for a week, maybe two, they're ready
Yep.
for herbals. So,
Okay.
but the key, I think you're right in that, especially patients who've had GI problems for a long time, you don't fix them overnight. You want to let their bodies kind of adjust to the new normal. So you
Okay.
may widen that window for people who've been sick for a while. So you may have them do diet strictly for 2 weeks. Then you may have them do 4 weeks of probiotics and then the herbs. This is just kind of the art of medicine when you kind of get a read for what patient needs what, rather than protocol.
You've
But I
exactly
will say
just
that,
nailed that. It's an art. It is. And though everyone listening, this is not in any way to sound patronizing. There's going to be a range of practitioners, but don't be frightened to apply this art. That's what it is. So just go. I mean,
yeah,
everything that Dr. Joe has been talking about is safe, sensible practice, and it's just making these changes in a very gradual way. So you don't have to throw everything at it in one go and think that you've got to just do all of this in one go. That's the pitfall that he and I both fell into, and actually just taking this in a slower way. And that it's an art form. And I think circling back to one of the first points that you made also in terms of what you learned about this is something that I feel is a really key point. Is like you said, don't give up. But
yeah,
part of that is actually the really important, what allows us not to give up is actually building that trust and that therapeutic relationship with the client. Because
yeah,
if you hadn't have done that with KB,
yeah.
she wouldn't have stayed the course. But you'd
Mhm.
obviously, you have, and that's a really important part of our practice, isn't it? It's building that therapeutic relationship, displaying that passion that whatever it takes, we're going to keep digging on their behalf. It's they're passing that on to you. So it's a really important component to the way that we practice functional medicine, isn't it?
There was one time where this was kind of in the middle, right before I did the stool test, where I said, KB, I don't have all the answers. I thought this was going to work, and I thought this was going to work, and I'm wrong. It didn't work, but I still think we have a couple things left to try. It's like, let's just see what happens here together. And I think that was part of the reason why she let me do the stool test was that
Okay.
I admitted that I didn't have all the answers, and that was
Yeah.
okay.
Yeah.
And I think that that's all right as practitioners. It's really important to say when you don't know something. That's one of the ways that we really, really, really can build patients' trust because in this world of TikTok and Instagram and instant opinions, the conveying social ideas that, you have to have the correct answer right now, immediately. And simply just admitting when you don't know something can go a long way to building that trust.
Absolutely. Yeah. Joe, this has just been so illuminating, and you've been so self-deprecating, and it is just such a joy. We would love to bring you back for another interview, and you can talk through more cases. I know that our practitioners will just be thrilled with this episode, and you've just been such a delight to interview. We will reference where people can find you to if they want to consult with you, if they want to do mentoring with you. We'll put all of your details in the show notes so that you can be easily found.
Good. I do see patients internationally. We can do video conferencing. That's not a problem. And so happy to help in any way I can. Absolutely amazing. Joe, thank you so much. And thank you for sharing your case. And I'm glad that KB is feeling infinitely improved. Yeah, me too. Thanks, Tanya. The views expressed in this podcast are that of the individual and not intended to be a substitute for professional advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition they may have, and should seek the assistance of their healthcare professionals for any such conditions. While we make every effort to ensure that the information we are sharing is accurate, we welcome any comments, suggestions, or correction of errors.